If you are a parent, there are two phrases that can sound reassuring in the moment, but may leave important questions unanswered. The first is, don't worry about it. They'll grow out of it. The second is, a lot of kids have that. Now, sometimes those words are said with good intentions. Sometimes a symptom really is temporary. And if your child is facing an emergency, an injury, a severe infection, breathing distress, a life-threatening situation, or anything acute and scary, the medical system can be incredible. Emergency care, trauma care, testing, stabilization, surgery, and medications when they are needed, those things save lives every day. This is not about replacing that. This is not about ignoring urgent care. This is about a different question. What if the issue is not an emergency, but it keeps showing up? What if your baby has colic, then reflux, then poor sleep? What if your toddler has ear infections over and over? What if your child is always congested, always coughing, always struggling with digestion? What if the headaches, anxiety, focus issues, anger outbursts, constipation, or stomach pain are not random little events? What if they are signals? A child's body is not a collection of disconnected symptoms. It is one connected system, constantly adapting to stress, physical stress, chemical stress, emotional stress, environmental stress. Some families also think about modern exposures like EMF as part of the bigger stress picture. The key is not, did one thing happen? The key is, how much has this child's nervous system had to carry, and how well is it adapting? Because when stress accumulates faster than the body can handle it, symptoms often become the language of the nervous system. That is why the phrase, they'll grow out of it, can be misleading. Many children do not simply grow out of neurological stress patterns. They grow into them. A fussy newborn who cannot settle may become a baby with reflux and poor sleep. A baby who cannot fully rest and digest may become a toddler with congestion, ear infections, or chronic inflammation patterns. That child may later struggle with breathing, asthma-like symptoms, gut issues, constipation, headaches, attention challenges, emotional regulation, or anxiety. Not because the child is broken, not because the parent did anything wrong, but because the nervous system may have been living in survival mode for too long. Think of the body like a car. The sympathetic nervous system is the gas pedal. It helps us respond to stress. It is fight or flight. It is alert, protective, ready to go. The parasympathetic nervous system is the brake pedal. It supports rest, digestion, healing, sleep, repair, and calm connection. Children need both. But if the gas pedal is slammed down all the time, the body has a hard time doing the quiet work of healing. That baby who only sleeps on a parent's chest may not be difficult. That baby may be searching for regulation. That child who melts down over small things may not be bad. Their system may be overloaded. That teenager with stomach pain, constipation, low mood, or social anxiety may not be dramatic. Their body may have been stuck in stress physiology for years. This is why a lot of kids have that is also not enough. Common does not always mean normal. If many children are struggling with chronic sleep problems, gut issues, breathing issues, anxiety, headaches, and focus challenges, that should not make us less curious. It should make us more curious. Instead of stopping at, lots of kids deal with this, we can ask, why are so many kids dealing with this? A holistic perspective does not mean rejecting medical care. It means widening the lens. It means asking about the full story. What was pregnancy like? Was there high stress? Was it high risk? Were there complications? Was there medical intervention involved? What was the birth process like? Was it fast, long, assisted, surgical, or physically stressful? Were there early feeding or latching issues? Did the baby struggle with sleep from the beginning? Were there repeated infections, medications, environmental exposures, emotional stressors, or big life changes? Those questions matter because early stress can shape how the nervous system learns to respond to the world. And when the nervous system is stuck in fight or flight, the goal is not to shame the child, suppress every signal, or tell the parent to stop worrying. The goal is to understand what the body is trying to say. The goal is to help the child shift toward regulation, toward rest, toward digestion, toward deeper sleep, toward better adaptation, toward a parasympathetic state where healing has a chance to happen. So if you have been told, "Don't worry, they'll grow out of it," but your gut says something is still off, listen to that. If you have been told, "A lot of kids have that," but you keep watching your child struggle, do not let common symptoms erase your concern. Your child's symptoms deserve curiosity. Your questions deserve respect. And your child's health deserves a bigger conversation than waiting and hoping. Look for providers who will take the time to ask about the whole child, not just the latest symptom. Look for people who respect acute medical care, but also understand that chronic patterns often require deeper investigation. Because the question is not just, how do we make this symptom quieter? The better question is, what is driving this pattern, and how do we help the nervous system feel safe enough to heal? That is the heart of a holistic approach to children's health. Not fear, not blame, not ignoring medicine, just curiosity, connection, and a willingness to look underneath the surface. Because your child may not be growing out of it. They may be growing into a pattern that can be understood, supported, and changed.